And I'm going back to moderating this session. I would like to start with the doctor. Thank you, Dr. Abla, for this conference, first of all. Secondly, for inviting us. And for the study that was commissioned by the ECES and includes a wealth of information. I would like to thank Dr. Ahmed. He's really clever researcher, and you managed to do a great job analyzing your data, but your presentation needed more scrutiny when it comes to some information so that we can build our visions and projections. So this is another part that you need to work on, but of course there are different aspects that were completely good and other aspects that need to be checked again by the Ministry of Health, and because there are differences. But sometimes it's hard to get the right information. I'd like to thank Dr. Abla for this study and for the other presentations, which I personally found to be very beneficial. The population topic is one of the that are closest to my heart. I've been working on it for years, and the whole earth is made up of people. So to have Egypt not lighting up the world with its population, I think it's a problem in itself. Egypt must be shining with this number of population, and it should be translated into an economic power. And here, this brings me back to the governance framework that you presented. Dr. Maha also was completely on point today. Someone said that the population topic became completely different when the resources are no longer provided from abroad, but are locally funded. I mean, those who were running the programs are Egyptians, even if foreign funded. So even if the management has changed, it has always been run by the same people. Dr. Ahmed excused himself because he has another meeting. So I asked him about his vision about the population. So he told me he's going to implement the national population strategy. And as you know, that it includes four objectives: reducing the growth rates, improving the population characteristics, redistribution, geographical redistribution, and bridging the gap between the different communities. Education and women, all equal development. So we're talking about a socioeconomic program. When it comes to family planning, it's very important for reducing population growth. And we need to achieve a balance between the economic development and population growth. It's an equation. I mean, whenever you tackle one aspect, you have to tend to the others. In 2019, now we are in 2019, and this strategy was set in 2014. It was set 5 years ago. It needs to be reviewed. Now the national population strategy is being reviewed, and based on this review, all of the gaps and achievements are going to be assessed. We need this review, and based upon that, another executive plan is going to be reformulated for 2025. And the executive plan, and I would like to ask my colleague, Dr. Germain, I would like to ask her to take into consideration the role of the civil society and the private sector, the parliament, and to integrate young people in this strategy. The 2014 strategy included a number of people who reviewed it themselves. Why am I saying that women and youth translate into economic development? Because, as Dr. Abdel said, this is the only thing that can change the whole perspective from of the population issue from a burden or from being liability to being an asset. The comparison between Malaysia and Tunisia were very clear, but we also compared Korea, Morocco, and Egypt, since that the three countries stood at the same point in the 50s. Korea made leaps and bounds in terms of development and particularly economic development, and they capitalized on the population growth. Egypt did not manage to do the same. However, it still has a very good opportunity because of the large number of young people in its active population. Morocco, up until now, did not succeed to put the policies that would help them to progress, and as such, it was a missed opportunity for it. Why I'm saying that there are high hopes for Egypt to tackle the whole population issue. And this includes all aspects of society, young people, women, and men, which brings us to social research. It's different from the past. People used to have more children only based on economic reasons. In some communities, people give birth for social reasons. So it's a completely different situation now. And these differences are not major, they're very subtle. But each community needs a nuanced plan. And here comes the importance of decentralization. How so? I do not work only from a vertical point of view, but on the level of the different governorates, but also on the level of the smaller villages. The population issue should be tackled from this perspective. So each community has its own characteristics, which require different plans. Mr. Samir, you've been working on the fields and devising plans in the different villages, and there is a regional council for population headed by the governors. You said that we have four factors that once aligned, we can reap the fruit of our work. So every agency should understand its mandate and should be held accountable. Accountability here does not mean blame. I should understand the excuses are the reasons that led to the failure of implementation. So this whole requires coordination, follow-up, evaluation. It's a whole coordinated effort. And despite the fact that in the greatest scheme of things, everyone understands the reasons, but nothing changes. This is what we should be examining. This is what we should be investigating to see on the level of the institutions, the society, or the relation between both. And here, the relation between the beneficiary or the woman using the contraceptives and the service provider, there must be continuous communication. If we're talking about quality of services, hindering the use of these contraceptives, this means that the quality of the service should be reviewed alongside the satisfaction of the customers, because both are parties to the same equation. So it's not enough for us to say that the quality is not good. The proof lies in the details. The woman who goes to a family planning clinic and who approaches the nurse or the doctor to get the contraceptive and sees her neighbor passing by, do you think that she will be able to get the suitable one and to use it? And would she be able to ask for the condom for her husband, for the whole world to know that her husband is using a condom? There must be privacy that should be that should be given and secured. This is a very delicate issue. And if we're talking about the health service, the characteristics of the whole service should be tracked and reviewed. And if we look into the ages of the women getting the contraceptives, if we go down to the street and ask young people about the contraceptives and the family planning methods, very few would know, because we used to have awareness campaigns everywhere, in schools, in the street, and television, but now these awareness levels are dropping. And if you ask them, are they going to use any family planning, they're going to say no. So the age groups that I am targeting, how am I communicating with them? They're not included in the analysis or the presentation, Ahmed.
We need to see the age groups. I can't say, for example, a woman that she has only one child, I can't tell her don't be pregnant again, but at least to give her some information, like, for example, if you would like to be pregnant, give it like 3 or 4 years to be pregnant again. What are the helping factors for the issue of the population problem, which is the legislation population framework, and here we invite the Egyptian Parliament to talk about this, and among this we talk about the religious speech. I totally agree with Dr. Maged that the religious speech is not the only factor, because here we are talking about other factors, education, about health, employment. Don't focus only on the religious speech. It's a whole system. For example, if I am in one of the villages that there is a project for Karama and Takaful, and there is no health center that provide family planning service, so I have here a problem. It means that I did not do any progress. I need results. If we work with this system, yes, for the foreign projects, they work it this way. The project of Takamul for the health program, they were working on the NGOs, on the health centers, on the hospitals, on the health department under one frame in the same time. So there were results for sure. We are going to work and we are not going to find results? No way. But we have to find the proper way to work. I don't want to be lengthy. I wanted to tell you that we have lots of challenges in the regional changements that is happening, and the migration and its effect on the social culture. And when we host some people or some people from other countries, and they do have the marriage age 15 years old, this for sure will affect us. This will make us think how we are going to tackle this idea. The social ideas that the women should be married early, and the FGM, we need to look at each fine details in addition to the coordination, which is considered to be very important, plus for sure the monitoring and following up. And the last point will be the studies and the researchers, where about 15% of the research budget, it goes to the population. How we deal with this, we have to ask the National Council for Population. How we are going to conduct the researches, we need to ask the National Council for Population. The budget, whenever we are talking about the budget, and we are not talking about the budget of the council. No, it is the budget of all the ministers that should be spent on the population. There are things that they are very clear. Actually, we don't have a national account for the population, but there are a specific fund, specific budget for the population. We need to calculate this correctly. So when we end up with the recommendation for the different ministers to adopt, to be clear recommendation, I'm going to stop here, and I would like to thank you very much for listening. Thank you. The point of migration is very important. Actually, our society is changing by time. The budget, 15% of the budget. I don't want to make you surprised. The amount of the budget of the state allocated for the scientific research. At the beginning, I would like to thank Dr. Abla for inviting me to participate in this conference. Actually, the issue of population is one of the very important issues. Actually, when we follow what happened in Egypt through the previous period of time, we see that in some time we read, for example, it's been like 50 years that we are talking about family planning and we did nothing. No, the program of the family planning in Egypt, if it does not exist, maybe Dr. Adel Bishay, he mentioned some results. For example, on the contrary, having this program led to important results, and I would like to just mention some of these results. For example, practicing family planning increased from 24% in the 80s to 80% in the year 2008. It was reduced in the year 2014 to 48%, but actually this means that we took the right way. The average children percentage was 7, then it was reduced to 3 in the period of time between 2008 to 2010. After it was for 3 and 6, we actually have a kind of increasement in the number of children in the family. The final increasement that happened in the year 2018, 3.5. If we studied the reasons, it will be clear for us. I wanted to say here that from the year 2000 to 2005, we found that there is a kind of decreasement and reducement in the birth rate. But then we found such an increasement in the birth rate. What happened in 2014? It was not a kind of surprise. It was very obvious from the year 2006, this increasement in the rate. And that was very clear in 2014 when we conducted the GHS. So if we studied the reasons of this increasement, we will find out specific reasons. The first one is the marriage, the increasement of the marriage rate till the year 2014. If we look at the marriage rate, it increased from 4 to 5 per each 1,000 women to 10 to 11 every 1,000 women, from almost the double. So this is a main reason from among the reasons. If this is a positive or a negative reason, we can't tell the people don't get married, but at the same time, the marriage cases, if they give birth to 1 or 2 children, as if I postponed the giving birth to a certain period of time. But the problem is if they continue on giving birth. So here we have to do a kind of link up between the number of children and the current situation. If we looked at the second reason, and here I would like to talk about the population aspect. The state is absent from taking proper decisions concerning this. The government took the decision not to employ in the governmental and the public sector. And when they closed this door, the percentage of the participation of the women working in the public sector decreased. So what is the alternative for not working? It is for sure giving birth and having children. So this is another reason that helped in increasing the number of marriage. And for sure the marriage in Egypt is related to the culture, to the mentality. All the women in Egypt, they want to get married. Once they are married, they start thinking of having children. And for this reason also we have an increasement in the birth rate in the previous period of time. What makes the problem more complicated, the lack of coverage of the family planning services all over all over Egypt. 12.6 from the demands of the married women are not provided. Okay, some of the women, they want to stop getting pregnant, but they don't find the proper method, and this is according to the studies that were conducted. This increase or reach to 16% in Lower Egypt. I beg your pardon. and 17% in Upper Egypt. The other point is the quality of the service. We have about 30% of the women, they stop using this message. They stop going to these centers because there is no awareness, because nobody is providing the proper service. So here when we talk about this percentage, this high percentage, some of it because of logic reasons and some for non-logic reasons. This percentage, this high percent, it means that we are not putting in consideration the population aspect, or when we analyze the situation, we don't put in consideration the population aspect. Then we don't have a continuous and a sustainable analysis for the demographic changement, and this leads us to be like surprised by all this changement that it's happening. If we have a good follow-up system to study all the changements, we will be able to know the reasons. The last survey that was conducted in 2017, we found that the percentage of the population under 15 years old is about 34%. 61% of the Egyptian population are under 30 years old. So we have a demographic opportunity, a golden one. We have the youth. We have this golden opportunity, as Dr. Abdel said. Do we have the capability to transfer this capability and the youth to economic income? This opportunity is the first part, creating the opportunity, but transferring the opportunity into income, it is related on the economic regulations that are taken. Is the state or the society? I don't want to say the state. Actually, I would like to say the society is taking specific regulations in order to create proper job opportunities, in order to absorb this capacity. This is the important point that we would like to talk about. The studies of the results of the survey 2017 showed that the situation is very bad. The percentage of the population less than 15 years old is increasing, and therefore the offers that the state can use as investment is decreasing and not increasing, although all the studies show that every Egyptian pound that is spent on the family planning, it saves 40 Egyptian pounds, and with the latest studies we found out that it saves 50 Egyptian pounds. So spending on the family planning is not just like spending, useless spending, and it is an investment, very important to be put in consideration. The latest study that was conducted to benefit from the demographic opportunity showed that we have all the urban areas in Egypt can benefit from the demographic opportunity, but most of the rural area will not be able to benefit from the demographic opportunity in the current situation. And here, the state can to set the priorities that will make it capable of benefit from the demographic opportunity to transfer it into a demographic income. I wanted to talk in a certain period of time, the resources that they were allocated for the family planning depended on the foreign resources, where the American Association and the UN Fund. The American Association, they said when we reach a certain level, they are going to withdraw from the work in Egypt. and they start minimizing their work in Egypt. And before withdrawing from Egypt, finally in the year 2006, a very important study was conducted about the strategy ensuring and providing the methods of family planning, and we explained all the regulations that should be taken by the government in order to replace the American Association. And the state start moving in this aspect, and the points that you were talking about in the presentation, like importing the contraceptives and the quality, and how it fulfilled the requirements of the Egyptian market. All these factors led to the absence of the contraceptives in some of the health centers. So the transmission from the foreign resource to the local resource, it wasn't a kind of a surprise. It was done by a study, and it was very well calculated, and the government should have taken the proper steps concerning this and the proper actions. Normally, I see the Ministry of Health, I see them that they work vertically. I see the health center is isolated, the family planning is isolated, the mother and child are isolated, and these three projects or these three aspects should be linked together, should work together. Everybody who worked in this field said that the best way to address the woman is direct before giving birth to her first child. So motherhood and childhood should be working with the family planning, and this unfortunately does not happen. Is there any intention in the Ministry of Health that it's going to change its plan of working? I think that what should be happen in the near future in order to improve the situation. The second point is in the field of, we start saying, I always wait for the women to come and pay a visit to the health center. On the contrary, I see that in the near future, I see that we have to change this way of work. We have to go to the women. We have not to wait for her to come to pay a visit to the health center. If these changements are not going to occur in a comprehensive system, so here is the big problem. So working in the field of population, it is the responsibility of all the organization, of all the ministers, but we should have a maestro working for the coordination between all of them, and I think this will be the role of the Egyptian Council for Population. And here, by the way, when the Egyptian Council for Population was very successful and was doing lots of progress when it was under the supervision of the president. But being part of the Ministry of Health, this were the period of times where the council was not successful at all. So I think the council should be very independent. So what's needed, the objectives are very clear, and yes, we are talking about 4 perspectives and aspects of the population problem, but we have to focus on the first aspect, which is the population. This is very clear. The objective is very clear. It might need some intervention from other related factors, but we need to focus on this factor that will make us able to deal in a better way. The last point that I would like to talk about, that we launched a strategy, the strategy of population and development in the year 2014, and as Dr. Hala said, it's been 5 years since we launched this strategy, but unfortunately we didn't see any evaluation for this strategy. Now when I'm talking with Dr. Amr about this subject, he said I need an evaluation for what happened up till now, so we can see. So I think the current period of time, the UN Fund will launch a teamwork that will be responsible for evaluating for what has been achieved according to the strategy, so we can move to the next step if the strategy needs any amendments, what are the priorities, why we did not achieve the objectives, what are the challenges that we are facing. This study is very important in order to say that the coming stage is going